I had a mentor that told me to check at 9, at 12, and at 5. People can get you. They can get you if they really need you. They'll call you. But you don't have to keep responding to every notification. Bing, bang, 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 bang. And then you go back and you respond to every single email. Well, how about if you set aside 15 minutes to do it at 9, 15 minutes to do it at 12, and maybe you need a little longer at the end of the day to address everything. How about trying one of these 14? Hopefully of these 14 that I just shared with you, right? Let's look at them again. Hopefully you have found something new to try. I hope. Because you know that stress can impact many aspects of your life. So what am I going to say next? You've already done exercise with me. You've done nutrition. You've done stress. So what do we think is the next pillar? Try to guess. I will show it to you. Sleep. Critical. This is something physicians have to work on, especially surgeons. And a lot of people need to work on this to honor and respect sleep. I've learned to honor and respect sleep. National Sleep Foundation recommends 7 to 9 hours for everyone 17 years or older. Could you take a nap? Sure. 20 to 30 minutes before 3 p.m. won't disrupt your nighttime sleep. Why do we focus on sleep? Well, our number one cause of death, we've already said, is heart disease. So American Heart Association studies this, cardiologists study this, and they share with us their data. Here is the x-axis you're familiar with, sleep duration in hours, and then hazard ratio for incident cardiovascular disease. So chances of having a heart attack. So if you are only sleeping 4, 5, 6 hours, you have a higher chance of having a heart attack than if you have the nadir, the lowest chance here, 8 hours. So between 7 and 9 hours is recommended. Now, too much sleep is associated with stroke and other conditions. Now, when you're depressed, when a person is depressed, many people sleep excessively longer. If you have obstructive sleep apnea, you could be sleeping longer periods of time because you're not getting restful sleep. So you're in bed for a long time, but you're waking up because you have sleep apnea. So you end up sleeping longer durations, and that is unhealthy. So it's 7 to 9 hours. Why? Well, sleep deprivation has been connected to high blood pressure, heart disease, obesity, diabetes. It really has an impact on all of our organs. Sleep. It's medically known, and in the literature, which you know I love, we study this and we figure out why. Why is sleep deprivation connected to high blood pressure? Here's short sleep duration. It changes our hormonal balance. We have increased ghrelin and decreased leptin. Ghrelin makes us hungry. Leptin keeps us lean and satiated. So when you are sleep deprived, you're set up, your hormones are set up to be hungry. Most people realize this, and research shows us this, as you'll see. We eat more when we're sleep deprived. And it's biologic. I'm telling you, it's hormonal. This is from the medical literature. We have a higher appetite, so we have more food intake. We could have poor diet quality, and we're tired, so we have less physical activity, may even have other sleep problems. We don't align with our circadian rhythm when we have short sleep. We want to sleep when it's dark, be awake when it's light, and get that light into our retina to help us and train us to be awake for the 12 hours and then sleep for 8, and we're relaxing somewhere around for the remaining 4 hours, right? Now, obesity can be connected with short sleep, metabolic syndrome, type 2 diabetes. There's a decrease in our insulin sensitivity when we're sleep deprived. This can also be associated to short sleep with higher blood pressure, systolic and diastolic blood pressure, higher blood pressure variability, and then a blunted or reduced nocturnal blood pressure dipping, higher morning blood pressure surge. This can bring us to hypertension. Now you have the medical explanation. Here's the research that I shared with you by telling you that sleep deprivation leads to insulin insensitivity. So remember, exercise leads to insulin sensitivity. If we are sleep deprived, we are not as sensitive to insulin. And research shows us this. As you can see, 5 nights of sleep restricted to just 4 hours per night results in a 24% decrease in insulin sensitivity. So if you have diabetes, prediabetes, or someone you know does, we need to think about sleep. Recommend healthy, restorative sleep and look at sleep hygiene. It's also a 30% decrease in acute insulin response to intravenous glucose, how we manage blood sugars. So, very important for everyone. If that material doesn't make you stop and think, this will. DWD. Anyone familiar with that? Driving while drowsy. This is important research looking at sleep deprivation and blood alcohol levels. It was done in Australia, and it looked at reaction time of people who were sleep deprived and reaction time of people who had been drinking at certain blood alcohol concentrations. So being awake 18 hours, reaction time is similar to a blood alcohol level of 0.05. Being awake 24 hours, reaction time similar to someone with a blood alcohol concentration of 0.10. And of course, 0.08 is legally drunk. So we know this literature now. It hasn't always been apparent to us. We haven't always known this. But for example, residents who are asked to stay up all night and monitor the patients in the hospital overnight, and they may be up 24 hours. Well, that happened to me when I was a medical student back in the 90s, and I drove home and I fell asleep and I woke up in a place I didn't know. Thank God I didn't hurt anyone or myself, but I didn't take a left turn. Instead, I went straight and somehow hit the brakes and woke up. I don't know. But nowadays that wouldn't happen, because if you're up all night, you take an Uber home. That's the residents get a voucher to take an Uber home. So this is critical, not just for medical people and residents, but this is a place where we force individuals, human beings, residents, young doctors, to stay up all night. So now we have to do something. If we make them stay up all night, we can't have them driving home. So you think about yourself, and when you are sleep deprived, maybe you should not be driving. How are you going to help yourself with your sleep hygiene? Well, you're going to make your bedroom like a cave. Quiet, use earplugs, use white noise, pink noise. Pink noise is like raindrops or a river flowing or waves. Use something so that it can help you stay asleep. You may need the earplugs. You may. Make your bedroom cool. Not a lot of people talk about this. 67 degrees is the sweet spot. Somewhere between 60 and 70 degrees will help you. Why? A drop in core body temperature is a signal for sleep. So you want your bedroom to be about 67 degrees. Play around with it. Where's your temperature now in your bedroom? Try it a little lower. See how your sleep is. Of course, you need to avoid blue wavelength light. So that's from your screens, your phone, television, iPad, computer. You can get blue wavelength light blocking glasses. You can get apps, or you could just turn everything off for 2 to 3 hours before bed and enjoy a relaxing evening, maybe a warm bath, maybe some chamomile tea to help your sleep. You want it dark in there. So you know, it's summer now, it's spring, summer. So you need these curtains that can really block out the light so you can stay asleep up till the 7 or 8 o'clock, whatever you need to get the 7 to 9 hours of sleep. Really important. Here's caffeine. We talked about it when I asked you several questions to begin, and I wanted you to pay some attention. So caffeine binds to the same receptor as adenosine, but it has the opposite effect as adenosine. So you're saying, well, wait, what's adenosine and what does that do? So we have ATP. That's how we get energy and use energy. And adenosine builds up throughout the day. As we break down the adenosine triphosphate, we get adenosine. Adenosine levels are at their peak at 11 p.m. And that's when we feel our sleepiest. It's another sort of signal for sleep, a high level of adenosine. Well, if caffeine binds to the same receptor, then you won't get that signal. In fact, as you well know, caffeine will rev you up, and you'll get adrenaline and you'll be awake. This is what people do when they drink their coffee or tea in the morning. And by the way, there's phytonutrients in this plant of coffee, and 2 to 3 cups before noon, definitely before 3 p.m. is good for you. Now, we're not saying drink coffee if you don't drink it and you like green tea, or you don't drink any caffeine at all, that's fine. But if you do drink caffeine, you must be aware that it's going to impact your sleep. And the half-life is 4 to 6 hours. So if you drink it at 3 p.m., half of it's in your system at 9 p.m. when you may be winding down for sleep. That's why most people recommend you consume it before noon. If you have trouble with sleep, before 10. And a lot of people keep it at 8 o'clock just so that they can be free of it. And that adenosine can do its job at 11 p.m. and help you fall asleep. So think about that. Now, metabolism does vary. So yours may not be 4 to 6 hours, but you have to experiment with it and see. Now let's talk about the connection between sleep and food consumption. As I mentioned already, sleep insufficiency is associated with significant increase in the desire for weight gain promoting or high calorie food items following sleep loss, the magnitude of which is proportional to the subjective severity of sleep loss across participants. Specifically, volunteers who slept only 4 hours ate 300 extra calories compared to those who got 9 hours of rest. You know, metabolically, physiologically, why that happens. I shared it with you. Ghrelin goes up, that makes us hungry. Leptin goes down. Leptin usually helps us stay lean and satisfied. But when you're sleep deprived, you got the high ghrelin, you got the low leptin, set up for calorie consumption. Now we're getting close to the end of our time together, and we're going to move on to another pillar. I wonder if you can guess which pillar I'm moving to now. Poor sleep can impact mood, outlook, productivity, creativity, sociability, relationships. It has been written and seen in research by Dr. Walker, a sleep expert, that those that are sleep deprived have a 30% higher likelihood of experiencing an amygdala flare. Amygdala is deep within your brain, near the hippocampus. The amygdala responds to threats. And it just is emotional and irrational. And so sometimes people get triggered, and they're more likely to be triggered if they're sleep deprived. As I said, 30% more likely to be triggered in this way and let their emotions just run. And they do not use their prefrontal cortex, CEO of their brain, to experience their environment, to listen to words, to understand what's happening. They get a threat, the amygdala responds to it and takes over. And this is when, again, people are irrational. So we don't want this. And it doesn't help with relationships. It doesn't help at work. It doesn't help when you're driving your car. It doesn't help at all.